Ideen Zarkin is with us today on our global chat, Nursing Care. My name is Sue Kerby. I am the coordinator of study abroad at COD, and Ideen is a professor in our nursing program, and she's going to talk to us about her programs and the COVID-19 pandemic. So, Ideen, why don't you tell us a little bit about your background?
Sure. I've been a nurse for well over 35 years. I have been teaching the CNA program for 20 years, both on the East Coast and here in Illinois. I have had businesses such as a home health care agency and a CPR business, and I have worked mostly in geriatrics and in hospice care.
Great, thank you. Well, your expertise is going to be very excellent to have here on our program today.
Thank you.
So maybe to get started, it would be good for us to understand what the nursing program is at COD and your involvement in it. You mentioned CNA, so maybe start there and tell us what that is, and then tell us what the nursing program is like at COD.
Okay. Well, the CNA program is the entryway into the nursing program. It's a prerequisite, and it's very important because it teaches all the basics of patient care. It is overseen by the Illinois Department of Public Health, and it's quite rigorous and really challenges the student to see if they are interested and capable of handling the nursing program.
So when you say the basics of nursing, tell me, like, what types of things do you teach in the CNA program?
I teach them things such as residents' rights, safety, infection control, the basic levels of care such as dressing, grooming, feeding patients, toileting, range of motion, all kinds of different things.
Yeah, so that's
and
a lot of
personal care.
Yeah, a lot of very close contact between the CNA and the patient.
Yes.
Yeah,
yes.
okay, great.
And a lot of patience.
Yeah.
A lot of patience for one CNA.
So then after a student covers the CNA program, which is correct me if I'm wrong, 8 weeks or 16 weeks, depending.
Yes.
Okay, once they finish that program, they can go into the workforce as what role in a hospital or nursing care?
They have to take a state board exam, and once they pass that, then they are considered to be a certified nursing assistant.
Okay, and then they can go directly into the workforce there if they want.
They can, they can. And most of our students will go to a nursing home, a hospital, home care. There's a lot of different positions, and there is always a need.
Right, and then the next step is if they do that, then they could also continue on into the associate's degree or bachelor's degree programs in nursing?
Yes, they have to do all their gen ed courses, all their prerequisites, and then they can apply and then hope that they get in, and the rest will be a nice story.
I bet you have a lot of students who do both, who go into the workforce after their CNA while they're continuing their schooling.
I have most students that's what they do, and it's fantastic because it gives them an opportunity to really adjust and adapt to learning how to work with patients, one-on-one as a CNA, and then make that transition into nursing. I think it's very helpful.
Right, gosh, not everybody can become a nurse, or not everybody has the personal kind of skills and temperament and just desire to do that. So kudos to those who can, because it's a difficult job.
Absolutely.
Okay, so let's shift a little bit to COVID-19 and the pandemic. I know that when it came to be an issue in the United States in March, it really affected your program. Tell us a little bit about what happened in the spring and what's going on in the summer.
Okay, well, last spring, things were happening so quickly and everything was fluid that we really quickly had to pivot and change the program from a face-to-face program to a remote program. And although we did have a hybrid, we still do have a hybrid program where part of it is online and part is face-to-face. This was being changed from the very beginning to fully online, and it was a lot of work and a big change for the students who did not actually sign up for an online program, and they needed consistency and a lot of support to get through this. And the majority of them did, and they did quite well.
Yeah. And how did it do the required state requirements in terms of patient contact and clinicals?
Well, that's what was probably the most difficult, is that the students could not go to clinical with the same period in time that they normally would. So there's been a postponement of that, and July is now when they're going to be going for clinical. And actually today and tomorrow, the CNA students have CPR, which is also something that requires face-to-face teaching, and only now have they been able to finish that up.
Yeah, so the spring students actually didn't complete in the spring, and now they're doing it in the summer.
Exactly.
And did you have any classes that were summer classes that were able to meet or not?
You know, I think that it was best that we did not have summer classes, because I think ethically it's very difficult to offer a class when we don't have answers. We don't know when we can do the labs. We don't know when we can do clinical. Whereas the spring semester came upon us so fast that the classes had, they were just starting, and the anticipation was we would go back to face-to-face. So there were no summer CNA classes. And come the fall, we're going to be starting with the labs and the clinical, along with the didactic portion, obviously, just in case. Not necessarily that we're anticipating anything, but again, we have to offer the student what is the best practices, what is safe, and truly so that at the end of the period they can become CNAs and not have this waiting.
And what are the hours that a student needs to be in an actual setting versus in the classroom?
There are 40 hours of clinical minimum. And Illinois Department of Public Health, which is the body that governs the program, because of COVID, they have allowed us over the spring and summer to offer 40 hours online where the students were doing their skills by making videos and what have you. And only now we're going into the hospital setting for those other 20 hours.
Okay.
But normally it would have been 40.
Yeah. Okay. Good information to have. All right. So what specific training happens in the CNA program that is related to infectious diseases, that is relevant to what's going on? What are the specific things you train students to know?
Okay. In every CNA program, we focus highly on infection control, and this includes standard precautions, which is always having a barrier, using gloves and hand washing especially. Whenever the possibility of coming into contact with bodily fluids is possible, which is always for the most part. So we have always focused on that. But however, now I think that it's really come to light with COVID, the importance of it. We're seeing what happens, in real life, what happens when people don't wear a mask. And now students and healthcare workers have to wear a mask whenever they're working with patients. So the standard precautions, as well as PPE, the personal protective equipment, are things that we teach them in order to protect themselves and in order to protect residents and patients. And now it's being used with every patient.
Yeah, right.
So they are well prepared. And the truth is, once we teach them, then we encourage them to go out and teach other people.
Yes, you see
So that helps the community.
Yeah, you see them in the society talking to people, could you put a mask on me? I'm a nurse, yes. I'm a healthcare provider. Yeah, that's great.
Yes.
We need that spread of information that comes from a professional. So great.
Absolutely.
Yeah. Okay, so specifically, let's talk a little bit about nursing homes or long-term care facilities, because we've seen a lot of news around the world of the impact of COVID in those settings. What specifically do you think is going on? Why, I read that the mortality rate from COVID-19 in nursing homes in particular in Illinois is over 40% of patients who come down with COVID-19 pass away are in nursing homes. So tell me a little bit about what you think is going on in nursing homes that has caused this issue to be so severe.
Okay, I think that a person who's in a nursing home has many comorbidities. So they have many illnesses and they are sick, they are elderly, their immune systems are compromised. I think at the beginning of the pandemic, there was not enough PPE. I was receiving phone calls from nurses within the community begging, can we please Do you know anybody that could donate? Do you have any masks? And, I'd spend days making phone calls and giving them to some of the big hospitals and nursing facilities and home care agencies in order to support, nurses and make sure that they and the patients were protected. And I think that was an eye-opener, because now they're producing so much, but initially there was a problem with the shortage of it. I think that putting what they have been taught, whether it's a nurse or CNA or what have you, putting it into action is what matters. Not just the learning of it, doing it every single time. And, we see a lot of cases where, unfortunately, in the beginning, people, not necessarily medical professionals, it could have been janitors and what have you, were not aware or not using proper infection control methods. We're not using PPE. So when they were quarantining patients or residents to an area of a nursing home, and they were moving furniture and moving, tables and what have you, and patients, perhaps they were not protected. And there are circumstances in our community where this has happened, and people, the employees have died, and subsequently, unfortunately, residents have passed as well.
Yeah, I think this pandemic made us understand that although a lot of times in our professions we know what we're supposed to be doing, it's easy to become lax. And then when you have this situation, that it becomes so obvious that where we have all become lax, we need to start becoming more serious about following the rules as 100% instead of 90% of the time.
Absolutely. And especially since this is airborne, you just, even having a conversation with anybody, coming into close contact, even breathing, not necessarily even speaking, there's the risk of contracting it, risk of passing it. So I think that it's also put a heavy emphasis on wearing a mask, where initially they told people that it wasn't necessary unless you were in the healthcare profession.
Right.
So the evidence is constantly changing, and sometimes it nullifies previous information. And I think keeping up on research is very important.
Right. The current recommendations are not the same as they were 3 months ago, right?
No, they weren't.
One of the other things I was reading about when I was preparing for this was issues in the nursing homes with, first of all, I read that the average wage for a CNA in a nursing home is about $13 an hour. So we have certified nurses assistants who are working multiple jobs to try to make ends meet, who are working at multiple nursing homes to get the hours they need. Talk a little bit about staffing at nursing homes and what changes need to happen to make that better.
Oh, that's a big question. I think that recognizing the importance of CNAs, paying them what they are worth, which certainly is much more than $13 an hour, giving them the respect that they deserve. They are the eyes and the ears of the nurse, and they are typically the ones that bring most information to the nurse for them to then intervene.
Do they see the most? They see the patients the most? They have the most contact?
They do. They have the most contact, the most hands-on care in every aspect. So I think just recognizing them and recognizing the importance, the roles of CNAs and of nurses are so important right now, because we would have really been in a much worse situation had we not had these wonderful caregivers that go to work every day regardless of the pandemic.
Yeah. It's been interesting to watch the reports coming out about COVID-19 and long-term care facilities and nursing homes around the world. So tell me a little bit about how it differs around the world compared to the United States, because we have seen issues in Italy and Spain in particular, where nursing homes have been devastated. Elderly people have been devastated in nursing homes with COVID-19, just like here. But what other places around the world maybe has it been a little different, and why?
Well, I think it's very different in the United States, because in most other countries, the elderly are cared for by their children or other family members, and they're kept home. So there is more independence for the family members and more autonomy for the patients. When they go to a facility, we have to remember it is still an institution and there are standards that have to be met. And unfortunately, during this pandemic, family members have not been allowed to visit their loved ones. Mm-hmm. And I've had a lot of people that I personally know who have lost their parents due to COVID, and we're not able to be at their bedside. We're not able to say goodbye, and we're even afraid, some of them, to go to their parents' funeral. Just now, with the reopening of phases in Illinois, our family members only allowed to go to visit their loved ones in a nursing home. And, you know, we all need support, but imagine the psychosocial effects on the elderly, the isolation, and again, this is devastating, devastating for somebody that's sick, somebody that's frail, somebody that's old. And again, you are at the mercy of the caregivers there, and it's not easy.
As we've seen in the reports, those caregivers have been the people who have been providing that emotional support for the residents because the families can't come in. So add that to their job description, as they are the hand holders and the conversation starters, so that the residents aren't isolated. And now we put that burden on the CNA and the nurses as well.
Absolutely. And, that is something that the CNA always tries to develop, that bond with every patient. Mm-hmm. However, it has been just so important right now. And I'm just so impressed by the CNAs that continue to go to work every day. Many of them have become ill themselves and go right back to work when they are cleared, and the nurses as well. The dedication and, compassion for people is just amazing and outstanding.
That speaks to the need for testing and the need for the PPE, the personal protective equipment, so that they can be safe and return to work as soon as possible.
Exactly.
Yeah,
exactly.
Right. Good. Yeah. I was, interestingly, I was reading about elderly in China and discovered that the Chinese Constitution actually has a constitutional requirement that children take care of their elderly parents. It is something that the government requires through the Constitution, which is a very extreme difference from the way we do things here. I also was reading that in Sweden, each municipality at the local level is responsible for making sure that the elderly in their community are taken care of. So you have that government support to help the families do that care. And I read that let me look at my notes really quick. In Sweden, over 90% of seniors over the age of 65 still live at home. And because they have the local government and their families taking care of them, it helps. So, if you compare that with the U.S. System of caring for our senior citizens, it's very different.
Very different.
And,
very different.
And with COVID-19, I think this has drawn a lot of attention to how we care for our seniors and our elderly in our population. So CNAs and nurses are very, very important in this whole process. And I think this has highlighted how important they are and maybe where we can make some changes to make things better.
Absolutely. Absolutely. They have been the heroes of this pandemic.
So if you could give some advice to any student thinking about entering a nursing program, whether, starting in the CNA program or thinking about it, what advice would you give them?
I would tell them to go ahead and take the CNA program. They have nothing to lose and everything to gain. It is the foundation for many other healthcare professions, and it will really give you an understanding if this is for you. If going to nursing school is something that you want to do, it gives you an understanding of caring and the compassion and the support that we give the elderly, as well as all the skills that it takes to do it.
Yeah.
And
That's great. I love the fact that the nursing programs in particular have that first step that is hands-on, so the student can truly, it's in the field studies and study abroad office, we talk about experiential education, and the CNA is the first step of a truly experiential component of the nursing training. You don't want to get 2 years into the nursing program before you realize you're not really you don't really like nursing. So the CNA program is where the students can discover, is this for me? And they do that really early on, and I think that's a great part of the education system.
It is. It really is. And I think that, having a prerequisite for CNA is so much better than having the students taking a fundamentals course where it's pretty much just theory. Here you develop a relationship with patients. You're actually on a floor and doing clinicals, and you're in that situation that you can really have the opportunity to self-reflect and decide, is this really for you?
Right. Yes. Excellent. Well, Ideen, thank you so much for talking about the CNA program and nurses, and in particular, nursing home during the pandemic. It's really been an interesting conversation, and I appreciate you joining us.
Oh, thank you. My pleasure.
Good luck in the fall as you transition to yet again a new way of doing the CNA program.
Absolutely. Thank you. Thank you, and stay well.
You too. Goodbye.
Bye-bye.